health advocate, but I have special interest in youth health. So we are here today to talk to you about hypertension in youth. I'm sure some of you will be thinking that, oh, hypertension is a disease for adults or grown-ups. Is that what some of you think? Yes. Hypertension used to be a disease for grown-ups in the past. But these days, we are seeing that young people are beginning to have high blood pressure. Hypertension is the same as high blood pressure. So we've realized that at the hospital, there are young people like you who come with high blood pressure. And why is this so? We have identified a number of causes of high blood pressure in young people. And so we want to educate you on some of the things that will let young people like you, who under normal circumstances shouldn't have high blood pressure, but it is happening now. So that is why we are here today. We are going to talk about high blood pressure. So let's take a moment to say a prayer. Father, in the name of Jesus, we thank you for this gathering. We thank you for bringing us together here. We thank you that you brought us to listen to your words, and we are here again to listen to an education on health. We pray that let the Holy Spirit open our hearts and minds so that whatever we discuss here, we would keep it and apply it to our lives, grow up to be healthy adults that will fulfill the destiny that you have created for us. In Jesus' name we pray, amen. My presentation will cover this scope. So we'll look at in some introduction, a brief one, maybe I've even done it already. We'll look at definition, what high blood pressure is. We'll look at the causes of high blood pressure in young people like you. We'll look at the signs and symptoms, complications, and prevention. Then we'll conclude. For you to be good leaders, you need to be healthy. You can be endowed with great potentials, but if you are not healthy, you might not be able to execute your potential. Do you agree with me? Yes. You might have the ability to do certain things. You have those skills, you have the knowledge, you have the talent. God has blessed you with it. But if you are not healthy because of certain things you did not do right, you will not become that productive adult or productive leader that you are supposed to be. So let's look at what high blood pressure is. High blood pressure is the same as hypertension. They are used interchangeably. So when you hear high blood pressure, know that it's the same as hypertension. So high blood pressure is when the pressure in the blood vessel is persistently high. Remember, the word is persistent. It means all the time when this blood pressure is taken, it is high. And that means this pressure is pushing forcefully against the walls of the blood vessels. So anytime the blood pressure of a person is taken and it remains persistently high, I will come to tell you what high means for every age group. So if it remains persistently high, it means the person has high blood pressure. We don't just use one reading. For instance, we take it today and it's high. We won't just say because the blood pressure is high today, the person is a hypertensive. No, we would have to check. Sometimes we'll give a period of 1 week for the person to check so that we have a profile, and then we can, based on that, to make the diagnosis. So for young people like you, when the blood pressure is up to 130, if we measure blood pressure and we get up to 130/80, it means the blood pressure is high for your age. For medical purposes, youth, the definition of youth is anyone who is between or from the ages of 15 to 24 years. You are a youth. I know in the church, youths can go up to 40 or 50 or around that age. But for health purposes, WHO defines youth as anyone or people within the age group of 15 to 24 years. So anyone from the age group of 15 to 24 years, when we take your blood pressure, we should have readings that gives us less than 130/80. An adult by WHO is anyone who is above the age of 25 years. So for them, BP of up to 140 is permitted. But when you are not 25 years and above and your BP is already reading up to 140, that is, even the 140 is borderline hypertension. And for youth, the 130/80 is a borderline hypertension. It's a range, so the lower reading can be 160, and then the upper reading shouldn't go above 130/80. Do you understand what I'm saying? So high blood pressure or BP readings is a range. It's not static. So it's a normal range from anything of 100/60. When we take the blood pressure, we write it in two figures. I don't know whether any of you have seen blood pressure recorded before. We record it in two figures. It's always something over something. So the lower margin can be from 100/60. It's a range up to 130/80 is normal for youth. So if I take my blood pressure now, I might read 120/80. If I take it again within 2 minutes, I may read 122/75. It's still normal. It's not static. It will keep changing. So all that range is normal. But when it's now hit 130/80 for a young person who is not up to 25 years, then it's high. Above 25 years, 140/90 is high. Good. And for those who are physically active, like the athletes and sports people, you can have your blood pressure lower than even the lower limit, and it's normal. So that is the definition of high blood pressure. Let's look at the causes of high blood pressure. But some of the causes, and this is important, we have said that there are certain things that young people do that make them at risk of developing high blood pressure at a younger age. One of the causes is family history. Positive family history means you have, or one has a family member who has been diagnosed hypertensive. And in this, we are talking about close family members. We term it as first-degree family members. So this is a mother, a father, an auntie, a cousin, or an uncle. So you see, these are close relatives. So if anyone has one of these close relatives who has been diagnosed of high blood pressure, then the person is at risk. It doesn't mean the person will by all means have it, but it tells you that you have to do things right because you are at risk, because a close family member has it, so you have to do certain things right, and we'll come to look at those things that you would have to do right. The other thing, so the first one is family history. The other thing is smoking. So we have some young people who tend to smoke. I know those of us here, nobody smokes, but we may know people who smoke. It means they are at risk of developing high blood pressure. And it will be good if you advise them, because in addition to other things that the smoking will cause, they can develop high blood pressure. Alcohol can also put people at risk of developing high blood pressure. Usage of drugs. You see, these are all substance abuse. And we always say these things are no good. They are no good because they affect the organs in our bodies. So aside family history, alcohol, drugs, smoking, we also talk of unhealthy eating. So what do we mean by unhealthy eating? There are people that like a lot of fatty food, oily food. When we prepare our fufu or banku, we want to see oil on top of the abenkwai or the granola soup. No. You can eat the granola soup, you can eat the palm soup, you can eat the okra, but avoid the oil. So you use less oil to cook. Soups like granola soup and palm nut soup come with its own oil, isn't it? So what you do is that you scoop that oil and put down. You can use that to prepare stew later, but you don't leave all that oil on top of the soup. And by the time the soup is done, the oil is also done. Where is it going to? Into your system. And that can make you be at risk of developing high blood pressure. We are still on unhealthy eating. So salty food. There are people who like salt. When the food is prepared and everybody is okay with the salt, some people want to still add some salt to their food. It means those people like excess salt, and that can put them at risk of developing hypertension. Processed food. So food that has been processed. These are unhealthy food. We are not saying don't eat it at all. You can eat it once in a while. Sedentary life. We know what sedentary life is. Some people don't just want to do any exercise. They want to sit at one place, even when we go to school and it's time for break time. Break time is for us to move out, stretch our legs, increase blood flow to our brain. But some people will sit in a classroom, they won't go out. When they go out, they'll go and find a place and sit and be talking. You have to walk around, so that the food you eat will be processed. It will be broken down for energy. And when you do this, you would prevent yourself from developing high blood pressure. It's not even only high blood pressure that this can cause. Diabetes is there. There's what we call non-communicable diseases. I'm sure some of you might have heard. And hypertension is there, diabetes is there, the cancers are there, high blood cholesterol. They are the diseases that happens because of poor lifestyle choices. So sedentary life can put one at risk of developing high blood pressure. And those who are obese, obesity and overweight, I can't see anyone who is obese here. We are all trim, so it means we are active. But you see, if you are eating well and you are active, you don't live sedentary life, you will not become obese. So you have to choose healthy food, and then you are active. Then you see that you are maintaining a healthy weight that will take you from non-communicable diseases, including high blood pressure. Good. So we are still doing causes. We've mentioned a number of them. Another cause is lack of sleep. And that's why I said young people are doing certain things wrong, and that's why hypertension is becoming common among young people. These days, young people don't sleep. True or false? A lot of young people don't have enough sleep. And they don't have enough sleep, not for any good cause. So it's social media. When it's nighttime and we must sleep, when it's 9:30, people are on their phone, moving from one TikTok to, and TikTok never ends. So they will be there by the time they realize it's 2:30. It's 2. You have to wake up at 4 or 4:30 and prepare for school. Even if it's 5, you are waking up and you sleep at 2. It's not enough. The normal sleep duration that every young person needs is between, even this is what we can't do much, it's between 7 hours to 8 hours. 7 hours should be the minimum. And then 8 hours is ideal. If I can do more, fine. But it's not even possible because unless you're on holidays, if you are going to school, what time will you sleep to make 7 hours? The minimum. It means most people that have to wake up and go to school, you have to wake up like 4, isn't it? Or 4:30. 4, because if you wake up at 5, it will be late. So 4 or 4:30 latest. So if you are counting back to get 7 hours of sleep, which is the minimum, because if you are doing less than 7 hours, then it's no good. You are packing some diseases for yourself, including hypertension. So if you count backwards, for you to make 7 hours, it means you have to sleep by, is it 10? 10. 9. You are waking up at 4, you have to sleep at 9. Yes. And how many of us sleep at 9? A few. A lot of people don't sleep at 9. Some will go till 10. And if you are sleeping at 10 and you are going to wake up at 4, it means you are going to have 6 hours, which is not good at all. It's not. And I'm sure all of us have heard that normal sleep is what? 8 hours. It's 8 hours we all know. So that you don't develop stress that will lead to high blood pressure and diabetes too. Most of the things that cause hypertension will cause diabetes. They go together. And these are diseases nobody wants to. And you see, when we don't do things right at this age, the moment we grow small and get to our 20s, getting to 30, then people are down with all these hypertension and diabetes because of things we didn't do right. So lack of sleep or inadequate sleep is also one risk factor. Stress. And how do we get stressed? A lot of young people are stressed up, or you are not stressed up. A lot of young people, sometimes people wonder that, but young people is grown-ups that we have to go and work and look for money and pay bills, pay the school fees, buy food. Why are you stressed up? You know, what I can think of is that some of you keep postponing, because most of you are in school at this age. So one of the things that brings stress to you at this age is your academics. When school starts and you go to school and they give you notes, assignments, most of us, all we do is assignments. Then we send, then we keep piling the notes. You pile the notes, then when it's revision time, exams week, that's when you are now struggling to understand all those notes. It will bring stress. This is general for people who don't do things on time. there may be other things that cause stress to different people. So you have to check that, because when you are stressed up, the body releases what we call stress hormones. There are some hormones called stress hormones that the body releases into the blood, and this will increase the blood pressure. So people can be stressed up, but it should be for a short period. If you are perpetually living in stress, then that will influence your health status in terms of hypertension, diabetes, and even some cancers too are caused by stress. So we also have medical conditions. There are some people that have medical conditions like kidney problems. So these are medical conditions that will lead to high blood pressure, and kidney problems too will cause high blood pressure. And the last thing I have here is advancing in age. That is what used to be the norm, that people will grow as people become 50 years, 60 years. Because of old age, the heart will become weak, the blood vessels will be weak, they will develop hypertension. That used to be the norm for maybe our parents and our grandparents' time. But this time, people don't grow old and they are developing high blood pressure, all because of the things I've mentioned above. So we have to do things differently and also advise people, our friends. Maybe we will be doing right, but we have to advise our colleagues we see who are not doing things right to do right. Good, so we are at symptoms. We're done with causes, so we are symptoms. Most of the time, high blood pressure will not present with any symptom. So people will come to the hospital and we'll check, maybe the person will come with malaria or any other thing, cough. And you know when you go to the hospital, the first thing they do is to check your vitals. We'll check blood pressure, we'll check temperature, we'll check pulse and respiration. That's what the nurses do at the nurses' desk. So most of the time, people's BP will be checked and it's high, then we'll say, oh, your BP is high. Okay, so we're giving you a form. Go home and check it maybe at a nearby clinic or at the pharmacy for 1 week and bring. They will go and check for the whole week, they'll come, it's still high. Then you tell them, the BP has been recorded for a whole week, it's still high, so you have high blood pressure. They will say, they say they don't have high blood pressure because it's because they are not having any symptoms. But that is how it starts. It will not give any symptoms. And that is the time to treat it. So the initial presentation of high blood pressure is no symptoms. That's the initial part. So when people are diagnosed and there are no symptoms, it's important for them to accept and start treatment before these symptoms come in. So because it's present with no symptoms, we call it the silent killer. Somebody can be there and say, oh, he wasn't sick, oh, he just complained of headache small and he cried. Because it has been there and the symptoms wasn't showing, no treatment. So by the time the headache came in, complications has set in, and then that caused the person giving up. And for us to prevent this silent killer, we have to do our annual checkup. So there's something we call annual medical checkup. I mean, the whole year, even if you are not sick and you never go to the hospital, once in a year, walk in and say, I want to do checkup. If for nothing, check your blood pressure and a few basic things to be sure that everything is going on well. Good. So when symptoms begin to set in, we now have headache. People will complain of headache. People will have dizziness. People will have blurred vision. And these symptoms can also be another thing, like malaria. You see, malaria will present with dizziness, headache, and those things. That is why when you go to the hospital and you complain of headache or symptoms of malaria, they will take your blood pressure. If you ever walk into any clinic, complain of any medical condition, they don't check your blood pressure, it's an error. That's one, the nurses will do it at the nurses' desk before you come to the consulting room. If it is not done, then it's an error, because we need to exclude high blood pressure before we know that, oh, the person has headache. Let's say it's even just headache, but BP is fine, so we are looking at maybe some other infection. So the person can present with blurred vision, pains in the eye, loss of vision. People can lose their sight, actually, because of high blood pressure. So anybody who goes to the hospital, those of us wearing medicated glasses, before they give us the glasses, they will check our pressure, true or false. They will check our blood pressure to be sure that the vision that we are not seeing well is not because of high blood pressure, because there are other causes too. So when blood pressure is excluded, then we know that, okay, we are not seeing well, things are becoming blurred, not because of high blood pressure, but because of some other, maybe eye condition or conditions limited to the eyes. People can feel their ears, they can have buzzing in their ears, like they feel noise in their ears because their blood pressure is high. People bleed from their nose. And as I said, when these symptoms begin to happen, it means it's complication. It tells you that those organs are being damaged because of the high pressure. People will not be able to sleep well. We call it insomnia, chest pain, especially left side. Remember, the heart is at the left side of the chest. So people will have chest pain. That's why sometimes chest pain, they say the person has heart attack, and the person it's a complication from high blood pressure that wasn't treated. Palpitation. So palpitation is when you become aware of your heartbeat. As we are all sitting down, our heart is beating, but we can't feel it. We are not aware of it. You become aware when you have done some exercise, run or jump, down, you feel there. That is normal. Or maybe something has happened and you get frightened. It's normal. But as you are sitting down like this, nothing has happened. You haven't run. You have not exercised. You are not frightened. At your normal rest, you can feel your heartbeat. Pop, pop, pop. That is not normal. It might be high blood pressure and needs to be checked. Some people present with breathlessness, like difficulty in breathing. It may be high blood pressure, swelling in feet. And those are all things that will be leading to complications. We'll come and look at complications proper, but these will be things that people will complain of and come to the hospital. Anxiety, they become anxious and restless, confused. Some are disoriented. Some will even convulse. They bring people to the hospital and say the person had a seizure or had convulsions. Sometimes it's high blood pressure. Sometimes it's also other things. Some people will vomit, and you see, feeling nausea, like feeling like vomiting and vomiting. They are also symptoms of malaria, isn't it? But they can also be as a cause of high blood pressure. So any of these symptoms can point to high blood pressure. It can also be other things. So we are looking at signs. Sometimes we say signs and symptoms. They are different. Signs, it goes together most of the time, signs and symptoms. So the symptoms are what the person will report to the hospital. So when somebody goes to the hospital and say, doctor, I have this, those are symptoms. Then we will also examine. Of course, we will check the blood pressure first thing. And when we check the blood pressure, we realize that if it is high blood pressure, as I said, 130/80 is cut off for youth. So we realize that maybe the person is reading that, giving us that figure or above. If it's below 130/80 for a youth. And medically, I said youth are people from 15 to 24 years. So that is where our youth end. Anybody 25 years going is adult. So 25 years and above, reading 130/80 is okay. But when the person hits 140/90, we say the person is borderline. So that is what we may find on examination. We also find what we call heaving. Heaving is when the heart is beating forcefully because of high blood pressure. So chest is literally lifting because the heart is pumping with force. So you see that, so that's heaving that we will see. We also have irregular heartbeat. Medically, it's called arrhythmia. I don't want to, but I needed to put that there too. So the heart will be beating irregularly. Usually the heart beats, there are two heartbeats. Normal heartbeats are two. It beats, if we use the stethoscope to listen to the heart, it beats lab, dab, lab. That's how it beats. So when we put that in our ears and listen, we hear lab, dab, lab, dab. But when it becomes irregular, we hear, it doesn't have any rhythm. La, 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 da, da, la, da, da. It beats anyhow, and that can be due to high blood pressure. And when the heart is beating anyhow, it can cause the blood to clot. So now you have blood clots forming in blood that is supposed to move normally. But now there are clots in there, and we'll come to see what clots will do as a complication. So we don't want all these things. We don't want irregular heartbeat. We don't want fast heartbeat. The normal heartbeat should be up to 100. It's a range. It's also a range from 60 to 100 is normal heartbeat. So when the heart is beating more than 100 beats per minute, it is high, and high blood pressure can cause that. If it's beating less than 60, the heart is beating slower. It can also be another cause, and we'll have to investigate that. There's a vein at the right side of their neck that will become very prominent and bulging. It's a sign of high blood pressure that is even causing a complication, leading to heart failure. So I am talking about things we will find when we examine. And then we'll see that the person has swelling feet. We call it pedal edema. When you press it, it dips in. They are all complications that may be coming up. We realize that the person is disoriented. The person doesn't even know where he or she is. Maybe the sun is really bright. You don't want a specific time, but you want to find out, is it morning, afternoon, or evening? You see that the sun is shining, but the person will tell you it's night time. The person is confused. He's not oriented to time. Maybe the child of the person is standing there and says, who is this person? Do you know the person? He said, no, he doesn't know the person. He's confused. He's not oriented. He doesn't know where he is and all that. And that can be as a result of high blood pressure. During examination, we will see that the person is probably in coma, unconscious, and we don't want to get to that stage. So those are the signs. I talked about symptoms that people will present, and then the signs are what we will see when we examine. So now let's look at complications. As I said earlier on, usually it will not present with any symptoms, and that is the best time to treat. When we begin to have all these symptoms that we have mentioned, they are no good signs. But even there, we can still initiate treatment, and if the person is compliant, the person will live a normal life. But now, there are some people that will not even take the medicine, and now this complication that might be fatal can set in. So the number one complication of high blood pressure is stroke. I'm sure all of us have heard of stroke before, and some of us have even seen someone who has suffered stroke before. So stroke happens in the brain, but the symptoms or the symptom is seen on the body. Two common complications of high blood pressure is stroke and heart attack. This is stroke. So you see that the blood vessel is supposed to transport blood, but when the blood pressure is high, what happens is that it destroys the inside of the blood vessels. When the inside of the blood vessels are destroyed because of high blood pressure, it tends to have small bleeds. And when the bleeding starts, it will clot. So high blood pressure that is not controlled will lead to the blood vessel being destroyed and causing small bleed inside. And when it bleeds, it forms clot. When it bleeds, it forms clot. This clot, when it travels to the brain has one of the tiniest blood vessels. So the clot may be traveling on bigger vessels that go through maybe the hand, no problem. But when it gets to the brain, because the blood vessels there are tiny, they block. So when they block the blood vessels there, you see that blood doesn't go to the other side. It's like pumping water through water hole. Then there is a stone blocking at a point. You see, it will stop there. When it stops there, it means the other side that is supposed to be nourished is not getting. And remember, the blood carries oxygen and nutrients. So the other side of the brain that is blocked by the blood clot is not getting nutrients. And that's how stroke comes in. And the body is said that the right side of the brain controls the left side of the body, and the left side of the brain controls. I don't know, has anybody heard this before? Yes. So when somebody has stroke and you see that the right side of the body is paralyzed, it means the stroke, the blood clot, or the rupture of the vessel happened. If weakness is here, it means it happened at the opposite side of the brain. If weakness is here, it means it's happening here. So this is it. So you see the diagram is showing blood clot. That's the blood clot that they have just enlarged it here. That is blocking there. You see that part of the brain that is affected has become dark. So it means all that part, because blood is not flowing and it's supposed to get oxygen and nutrients. So it's cut off in stroke. And this is stroke caused by blood clot. There can be another stroke caused by rupture, bursting of the blood vessel, also because of the high pressure. So stroke is caused by two mechanisms. One is the blood clot, this one, and the other is when the pressure is so high that the tiny blood vessels in the brain burst. So blood will just ooze on that same. And that's why most of the time the people come unconscious. And most of them don't make it. This one, the person will live with paralysis and may begin to do physio, put on blood pressure medicine and medicine that will break the clots, but it becomes a long journey. The other complication is heart attack, and the heart attack too is the same mechanism, the blood vessels around the heart. So when there's a blood clot and it's also blocked one part, you see that part that is darkened. That is the part that is not getting the blood that's supposed to carry nutrients and oxygen. So the people with chest pain, then some people will just give up in the process because of blockage from clots, and all because of high blood pressure. There's another complication we call heart failure. When the pressure is too high in the vessel, the heart has to pump with great energy. So as the heart pumps, at a point, it becomes flabby. In fact, it tends to increase in size and then it will become flabby, and sometimes it gives up, it won't pump again. They say heart failure. So heart failure is different from heart attack. It just gives up because it's tired of pumping, and that's it. High blood pressure can also destroy kidneys. The same mechanism. The pressure will destroy the blood vessels that gives the nutrients to those vital organs, and the kidney will not function, and some people will require dialysis or kidney transplant, which most of the time we don't get to do. It can also damage the eyes and loss of memory, all because of increased pressure destroying all those vital organs. So we're saying that complications usually lead to disabilities, which becomes a big burden for families and communities. So you can imagine somebody getting blind because of high blood pressure or stroke. That's a burden. The person can't do anything for him or herself again. The person is living, but as people say, vegetable, the burden on their family have to be pushed around here and there. So let's try and do things right. And as young people, we don't want to end up with these things. So all the things that we have talked about that can cause blood pressure, we want to prevent. We are on prevention now. So we've looked at causes, symptoms, signs, complications. So how do we prevent this scary disease that we are talking about? It's scary, actually. So when we talk of prevention, you think of two principles in every disease. You think of prevention, you ask yourself, what are the things that cause this disease? If you know the causes, you can prevent it, true or false? Yeah. Once you know the causes, you just avoid what they say will cause it, and then you prevent it. So those are the principles we work with when we talk of prevention. And then when you know the causes, you now modify your lifestyle. Most of the time, they are lifestyle choices. So you modify it so that you make the right choices. We talked of smoking. So if you smoke, stop smoking. Or if you intend to smoke, don't smoke. Stop taking alcohol. Avoid drugs. Eat healthy. And this one is very important. A lot of people don't smoke. They don't take alcohol. They don't do drugs. But the food, the kind of food we eat, is not healthy. So this health education is meant to empower young people. There are a lot of youth empowerment programs that go on. People will empower people to be bold, to be resilient, to be confident, yes. But sometimes we rarely talk about health, and we should empower everyone. We should make sure that everyone is empowered all around. We want to empower you in terms of your health, because sometimes those people that are doing the other empowerment, they are not health people, they are not health personnel, so they'll focus on be bold, be confident, take that step. Yes, it's good. But then what about your health? You'll be bold, you are confident, you want to take that step, but that bold step, but then you are not making good choices with regards to your health. So if you neglect your health and we don't fit in that gap to fill in for you, then all that confidence and bold step you want to take may be cut short because you didn't make good choices. So that is why the Sheila Dery Foundation is there. We fill in that gap. We empower young people health-wise. We do empowerment through health education. So we want you to stay healthy and make the right choices so that you grow up to be productive leaders. We say an empowered youth is a productive leader. We didn't say an empowered youth is a productive adult. No. You are a productive leader because even as young as you are leaders. In school, some of you are prefects, isn't it? In church, some of you hold leadership position among your peers. So you are not waiting to become an adult before you become a good leader. No, you are already a leader as you are young. So we want to empower you as you are a young person so that you'll be productive, because assuming you are sick, you are the school prefect of your school, but then you didn't make right choices and maybe you end up with some other health condition. Can you be productive as a school prefect? No. So an empowered youth is a productive leader. You are a leader now, still be a leader when you grow up for your generation and those behind you. Thank you. So we have two main social media handles. The YouTube channel has a lot of health education videos, short videos, long videos, both of them, all of them are there. You can just take the name of the YouTube channel. It's Lady Dr. Sheila, as it's written there, write it down. Lady Dr. Sheila TV. Even by the time you do Lady Dr. Sheila, it will appear. And then the other one we have is a WhatsApp channel. But when you go to the YouTube channel, you can find the WhatsApp channel there. We do mainly health education. And you can find a lot of different videos there, breast cancer, cervical cancer, a lot of things. We've dealt with a lot of things. There's a website too that has a number of those, and some articles that I've written. You also find them on the website. Thank you.